Regenerative Endodontic Procedure in an Immature Permanent Incisor with Internal Root Resorption.
This is our case report for today. Stay tuned with us. Hey guys, root resorption is quite a fascinating but challenging issue in dentistry. It occurs due to the loss of dental hard tissues, usually caused by the activity of odontoclasts. There are different types of root resorption. The introduction talks about external and internal resorption, which internal resorption seems to be less common.
That's correct. It's a resorptive defect that happens within the internal aspects of the root. It often appears as a round to oval lesion within the canal space.
Traditionally, it seems that root canal treatment has been the preferred approach for treating internal root resorption, right?
Yes, that's right. The introduction talks about using chemomechanical preparation and obturation techniques with thermoplastic gutta percha to treat internal root resorption.
But there's this newer approach mentioned, revascularization and regenerative endodontic treatment.
Let me explain. These techniques were initially developed in the 60s. The aim was to promote root regeneration by reestablishing blood flow to the tooth. They are especially useful in cases of the pulp necrosis in permanent teeth with open apex, promoting root development and preventing issues like root fracture.
The introduction also highlights a case report on a regenerative endodontic treatments procedure for a perforated internal root resorption in a tooth with an open apex.
Yes, exactly. It seems like a significant advancement, especially for the cases where traditional methods might not be effective. Let's delve into the case presentation.
The case is an 8-year-old boy who suffered a traumatic injury. He was referred for management after an incident at a swimming pool.
Poor kid. Dental traumas can be quite challenging, especially in young patients. What happened exactly?
According to the dental history, he had an intrusion injury and severe luxation that affected the positioning of the tooth. The introduction mentioned a cortical bone fracture and a mobility of multiple anteroposterior teeth.
They found an uncomplicated crown fracture in tooth 9. It was sensitive to palpation and percussion, but it didn't respond to cold or electric pulp sensitivity test. They also noticed a sinus tract that can indicate some deeper issues.
The initial radiograph showed that tooth number 9 was the cause of the sinus tract. They also noted internal root resorption and an open apex, which were confirmed through various radiographic projections.
So it seems the diagnosis was pulp necrosis and chronic apical abscess with internal root resorption. That must have presented quite a challenge for treatment planning.
Absolutely. They considered using CBCT to gather more information, but the patient's tutor rejected it due to economic reasons. Instead, they opted for revascularization and regenerative endodontic treatment.
The procedure started with local anesthesia and rubber dam isolation. They accessed the canal and established working lengths. They mentioned using an electric apex locator to help with that. And they also performed irrigation using sodium hypochlorite and EDTA.
Then they placed calcium hydroxide as intraappointment medication and sealed it up with temporary restoration. The patient was recalled 3 weeks later, and thankfully the tooth was asymptomatic and the sinus tract had disappeared.
That's a positive sign. They wanted to establish a blood clot to aid in the placement of the white MTA. The access was sealed again, and 3 days later they confirmed that MTA had set and proceeded to seal the cavity permanently. The follow-ups at various intervals are interesting. The case report seems to highlight the gradual healing and signs of the new periodontal ligament development.
Exactly. The patient remained asymptomatic and functional, but at 48 months, they noticed discoloration and had to address it. They removed the MTA, placed a composite restoration, and even performed tooth whitening.
Overall, it seems that a patient had a favorable outcome considering the complexity of the case.
These cases can be quite challenging due to the potential impact on the development of the tooth root structure. They mentioned how traumatic injuries often lead to internal root resorption by damaging protective layers of the tooth. And in this case, they even had intrusion injury, which affected the periodontal ligaments and prevented normal root development.
Yes, they pointed out that traditionally the treatment of the teeth with pulp necrosis and open apex was apexification, while internal root resorption was often treated with conventional root canal treatment.
Right, but in recent times, the regenerative endodontic treatments has emerged as a promising option, particularly for cases like this. And this method aims to restore vitality and promote sensitivity of the pulp tissue, allowing for repair and regeneration.
And the interesting part is that they applied regenerative endodontic treatment even in cases of internal root resorption, which they mentioned has been a less explored area in literature. It's quite innovative.
Indeed, they discuss how regenerative endodontic treatment can improve the prognosis by increasing root length and promoting root development, which might be beneficial in cases of internal root resorption where structural damage has occurred.
They classified their case as a stage 2 according to CIVIC's classification, considering the tooth's root development. It's important to tailor the treatment approach based on such classification.
They also highlighted the importance of using appropriate internal medicaments like calcium hydroxide to address the infected pulp tissue.
They also mentioned the significance of the gentle chemical disinfection using solutions like EDTA to promote survival of the stem cells and release of the growth factors for tissue regeneration.
And the discussion about inducing intracanal bleeding was interesting too. It seems like it creates a scaffold for tissue repair and introduces growth factors into the root canal.
They noted the occurrence of the discoloration after regenerative endodontic treatment, which is a common concern. In this case, they managed it by removing the MTA and applying composite veneer.
True, aesthetics can be a crucial factor, especially when dealing with cases involving young patients. And the extended follow-up they did up to 48 months helps demonstrate the long-term success of the treatment.
They acknowledged the limitations, particularly the absence of a CBCT evaluation due to economic reasons. That's a real-world aspect clinicians often face.
Absolutely. Balancing clinical decisions with patient circumstances can be quite challenging. And they also mentioned how the field was evolved with materials like biodentin being favored over MTA in recent times.
Indeed, they were working with the available knowledge and options at the time. It's fascinating to see how dental practice continued to evolve and adapt.
That's right. It's a reminder of the ever evolving nature of our field and the importance of considering both the available evidence and individual needs for each patient. Well, as we conclude, it's evident that regenerative endodontic treatment holds promise for treating severely traumatized teeth, especially in cases with internal root resorption.
They were right in pointing out the need for further clinical studies to solidify the success rate of the regenerative endodontic treatment in immature teeth with internal root resorption. More research will provide a clearer picture of its effectiveness. Well, that's it, friends. Thanks for joining us today. Hope you learned something new.
Sure, and don't forget to join the Pepe Barbsy family and never miss a moment. Goodbye.